Hello everyone, myself Rahul Ashok, pursuing my Bachelor of Physiotherapy degree from Marward University. So today in this video, we are going to cover dry gangrene and wet gangrene and their functional outcome. The main motto of this video is going to cover the functional outcome of dry and wet gangrene. In this video, we are also going to cover the difference between the dry and wet gangrene and the role of physiotherapy. So gangrene is a serious condition in which the patient body tissues die due to the loss of blood supply, and it mostly affects the distal limb like feet, toes, and understanding their difference between the dry and wet gangrene is important because it mostly affects the patient's daily life and mobility. Now we'll see what is gangrene. So gangrene is the death of body tissue caused by the reduced blood flow or an infection. When tissues do not get enough oxygen or nutrient supply, tissue starts dying. So it occurs in patient who is having diabetes, blood vessel disease, infections or any injury. If not treated early, gangrene can spread throughout the body and can cause severe complications. Now we'll see the types of gangrene, dry gangrene and wet gangrene. So first we'll see the dry gangrene. So in this it occurs due to the poor blood circulation. The affected areas looks like dry and shriveled and black in color, as you can see in this images. It spreads slowly and it is mild or less infectious, and it occurs in the patient who is having diabetes or peripheral arterial disease. Now we will see what is the wet gangrene. So it occurs when the dead tissue is infected by the bacteria. The affected areas looks like swollen, swelling over the affected area and having pus formation, painful, and it comes foul smell comes from it. Okay, it spreads rapidly and considered a medical emergency, and it requires immediate treatment to prevent from the life-threatening complications. Now we'll see the difference between dry gangrene and wet gangrene. So as you can clearly differentiate between the images, this is the dry gangrene. So in this it's a black in color, shriveled, okay, and this is wet gangrene. It is wet and swollen over the affected areas and pus formation, and it has swollen smell, okay. So in this the tissues are dry, and in this the tissues are swollen, okay, swollen or pus formation, okay. Then it spreads slowly because it's not that harmful, and it spreads rapidly. It's harmful, means it's dangerous, okay. So in this it's less infection and it's the more severely infectious, okay. And the dry gangrene is less dangerous, and the wet gangrene requires emergency complications. Now we'll see the functional outcome of dry gangrene. So first one is functional problem. So functional problem means like the patient will having the problem in their daily living activities like walking or etc. Then the pain during walking means whenever the patient is walking, the patient would have the pain on the limb. Then the reduced balance. Reduced balance means when the patient will not hold his whole weight of the body. Then the difficulty in standing due to the difficulty in standing due to the pain or weakness of the lower limb muscles. Then the gait abnormality, like the patient will change his or her gait pattern, like limping gait. So if this conditions become worsen, we have to ampute the part of limb or whole limb. So now we'll see the functional outcome of wet gangrene. So the first one is severe weakness. So in this the patient will feel fatigueness throughout the whole day, and low energy and reduced physical activities, okay, like physical strength, and the loss of limb function because due to pain the patient will not walk too much, so it will be having difficulty in their daily living activities. Then the risk of sepsis because it's a bacterial disease, so it can travel from affected area, it can travel through the bloodstream and can cause the sepsis. And the prolonged hospitalization means the patient have to stay for longer period of time in hospital for the treatment and monitoring and complication management. Then the post amputation rehabilitation means after the amputation, the patient is having the orthosis. So it requires the physical activities, physical therapies, and the rehabilitations and the gait training. Okay, so we have to make the patient adapted to the orthosis. Then the last one is psychological impact. So we have to talk to the patient to come out from the emotional distress, anxiety, depression, and the reduced quality of life. So now we'll see the role of physiotherapist. So you might be having question that in dry gangrene or wet gangrene patient, what can we give? Like we cannot give electrical modalities to the gangrene patient. Okay, so our role is the gait training. Like it will improve the walking ability, coordination, and mobility. Okay, then the strengthening exercise. Like we have to strengthen the muscles for better mobility and gait training. Okay, then the balance training for the stability, like okay, then enhances the stability. It also helps in the posterior connection. Okay, then the prosthetic rehabilitation, like after the amputation the patient will have having prosthetic. Okay, so we have to ask the patient to adapt to that, and it will help in the independent work. Okay, then the prevention of pressure sore. So we have to ask the patient to not be in a particular be in a position for longer period of time to prevent from the pressure sore. Okay, and at last the patient education. Okay, in that we have to guide the patient to all the activities and follow all the each and every precautions. Okay, then the for particular diabetic patient, what can we do? The foot care education, like we have to daily inspect the foot, it's having some progress or not. Then the keep feet clean and dry, like we have to see the feet is clean and dry. Okay, if it will be wet then it will be cause severe bacterial infection. Okay, then the proper footwear. So footwear should not be too loose or too tight. Then the exercise advice, we can advise the we can ask the patient to do regular exercise at home, then stretching or range of motion exercise, then the strength and endurance for better outcomes. So at last the circulation improvement. So if the blood flow is improved, it will help in reduce the swelling. It will help in promote the faster healing and the prevent from the severe complications. So the last slide. So at the end, I would just like to conclude that the dry gangrene and wet gangrene differs in their severity, progression, and the cause. So wet gangrene is more dangerous than the dry gangrene. Okay, means the wet gangrene spread rapidly as we have seen earlier. So both conditions can significantly affect the functional ability, and hence the physiotherapist rehabilitations makes it essential, and at the end it improves the quality of life. Thank you for watching.